Welcome to the All Points North virtual speaker series. My name's Anna. I'm the marketing director here at All Points North. If you are new to All Points North, we are a mind-body health brand that specializes in mental health, physical wellness, and addiction treatment. We have our main launch that's located in Edwards, Colorado, where we do a lot of our in-person services. We also have some services that we offer in Denver, and then we are opening a new office in Malibu to offer some workout and deep TMS services. So we are really excited to have the speaker series back up and running again. If this is your first time watching a speaker series, it is a free initiative to bring you mental health, addiction treatment, recovery information to be able to kind of put another tool in your tool belt and help you be better equipped to either live a life of recovery or help facilitate lives of recovery for other people, if you're a therapist or doctor or something like this. So we're really excited to have you here today. We have a really special speaker who has we've been working with for a while to prep for this, and it's going to be great. So you're not going to want to miss it. What we have first is just a few opening announcements. So first, the speaker today has some questions in his presentation. So while you are kind of thinking about these questions, and if you want to communicate and collaborate in the chat, please do that. However, know that by default, your chat name will pop up as whatever you logged into your Zoom account with. So if you would prefer to be anonymous, go ahead and change that name right now. We would love you to participate, but we don't want to make you uncomfortable. So if you prefer to be anonymous, go ahead and do that now. Also, you can submit your questions throughout the chat. So at the end, we are going to do a Q&A. So there's a Q&A box in addition to your chat. And so if you want to submit an anonymous question there or just a question for the end, go ahead and do that. So that just comes to the back. We can see it, but the other people won't be able to see it. So don't worry about if your name's on that or not. But we'll go ahead and answer those questions at the end. Otherwise, we're very pleased to have you today, and I am very pleased to introduce Stephen Kelly. Stephen Kelly is a licensed professional counselor and a certified sex addiction therapist. He is trained in post-induction therapy and has over 14 years of experience in the field. He has helped at least hundreds of clients transform their lives in recovery and mental health, and he strives to help create LGBTQIA safe spaces, awareness and understanding of the community, which is what we're here to talk about today. Before working full-time in the field of counseling, he actually served as a United Methodist minister for more than 20 years. So he has spent his life helping people from all backgrounds navigate twists and turns. And today he's going to be talking to us about creating safe spaces for the LGBTQIA community. Steve, we're so happy to have you. Thank you so much for being here. And the time is yours. Take it away.
Anna, thank you so much. And I appreciate so much All Points North Lodge giving me an opportunity to spend some time with you guys. And what a pleasure and what a awesome opportunity that we have today. So we're going to go ahead and get started. And like I said, like Anna said, there are some questions that I'm going to be asking. I want you to feel free to take a look at your chats, and we can definitely do that. So to enter your questions and responses. So I titled this presentation, Not Another Closet. And the reason behind that is that one of the things I know about people who fall within this demographic, within the LGBTQ community, often find themselves in situations where they feel stigmatized, that they feel that there is a disparity, especially within the mental health field. And we're going to be kind of exploring more of that. And so one of the things that I want to do for us as clinicians and as therapists is to provide an opportunity to where we can create an environment in our practice, within the work that we do in the mental health field, to where people within the LGBTQ community can feel like that they can be themselves. they can be who they are as they come into our office and as we work with them. So let's start. So one of the questions I have is that, who all's here? If I were to ask you to think about, uh, uh, are you a clinician? Are you a physician? Are you an LPC? Are you working in the field of addiction? Just share with me a little bit about just to kind of find out who's here. So take a minute, type in the chat, are you a nurse? Are you in the mental health field? Are you a licensed clinical social worker, LPC? I'm just curious to see who's here. So take a minute, and if you would, just kind of respond to that and let me know kind of who's in the room. I'm curious. Psychologist, great. Glad to have you here, Peter. All right, LPC, yeah, good. Awesome. Jerome, glad you're here. Yes, thank you. Okay. All right, well, let's get started. Thank you for your response. So kind of my little joke here, we talk about the gay agenda. So just a little piece of humor that I usually kind of pass on to folks just to kind of lighten the mood as we kind of begin to talk some. So basically what I want to share with you is what I hope to accomplish in our time together is to help all of us have a better understanding of the LGBTQ identities and their experiences. I want to go ahead and share with you, at least one cultural competency tool to improve self-awareness when working with special populations, especially within this demographic. And then also to come up with and share with you a couple of strategies that you can do in order to create an environment of safety and understanding for the people within the LGBTQ community. So one of the things that's really important in our time together today is that our time together is a safe place. And during our time together, it's safe for each of us to challenge our values, to take a good look at our value system. It's a safe place for us to kind of be open and honest about our attitudes, our ideas, and our perceptions. This is a safe place in our time together to say, I don't know, or I don't understand. The challenge for us is to be aware of our own sense of privilege. And what I mean by that is that I'm 65 years old. I come from a middle to upper class family. I'm white and I'm educated. That in and of itself has privilege. And it's important to understand and know what my privilege is so that I can better serve the people that I work with. It's also important for us to be aware of what we don't know, our own ignorance. And sometimes that's a difficult thing because I know sometimes for us as therapists, we sometimes have an expectation that we're supposed to have all the answers. Sometimes our clients expect us to have all the answers, but it's important to be able to be aware of the things that we don't know. It's also important for us to be aware of our own prejudice and our own biases. We all have them. Nobody escapes that. So this is going to be a safe place to explore ideas and concepts, to be able to ask questions and to be vulnerable with each other as we begin to talk more and more about this group of folks who oftentimes feel the disparity. So here's the first set of questions I want to ask, and I'd like for you guys to respond to this. First impression. When's the first time that you can remember learning that some people are lesbian, gay, bisexual, or queer? So take a minute and look at that. When was the first time that you can remember learning that some people are lesbian, gay, bisexual? Hmm. Middle school. Yeah. Okay. Yeah, absolutely. Just after high school. Yeah. Fifth grade. Okay. Okay. So some fairly early, some later, fifth grade, middle school, junior high, high school. Okay, good. So next question. Where did most of the influence of your initial impressions, understandings about lesbian, gay, bisexual, and queer people come from? You know, for some people that came from family, for some people it came from friends, maybe from books they read, television, movies, church, news. So where was that for you? Where did most of the influence of your initial impression and understanding come from? Family and church. Yes, absolutely. Okay. Okay. And news. Yeah. Great. All great responses. Next question. Where did most of the influence of your initial impression and understanding of transgender people come from? Another part of this demographic. Family, friends, television. Again, where do your impressions, first impressions, initial impressions come from as far as with transgender folks? Bruce K. Jenner, yeah, television. Okay, sometimes there's friends and books. Okay, yeah, yeah, great. Social media, friends, yeah. So the next question, how have your impressions and understandings of the LGBTQ people changed or evolved throughout your life? So maybe a follow-up question might be something like this. Thinking about where you got your first initial impressions, whether that was family, whether that was school, whether that was church, um, around impressions of LGBTQ individuals, was it positive or negative? So some for some very negative. Absolutely. Big changes occurred, in college. Okay. Yeah. Stereotypes. Yeah. Yeah. Growing up, rhetoric was gay as a choice. Feel like they were through learning and being open to conversation with others through the year. Yeah. Never any negative, but a lot of misunderstanding, a lot of misinformation, lots and lots and lots of misunderstanding. Yeah, absolutely. Absolutely. So here's what I would share with you. When we talk about what it takes to change, and I'm probably preaching to the choir, that what we know is knowledge base goals of change we find are so much easier than to change rather than our own sense of our attitudes and our behaviors. So it's one thing to change how we think, it's another thing to change our attitude and also behavior. So that's really important for understand that there is that dichotomy. Cognitive change is oftentimes much easier than putting that change into behavioral change. So one of the things that's really required for us, people who work in the helping professions, is that we have an obligation as providers of mental health services to work with our clients who oftentimes may have a different value system than our own. Not everyone who walks into our office shares the same value content and value system that we have. And so it begs the question that do we have an understanding of what we are and what we are not comfortable with discussing? It's really important for us as providers to be able to work with people who may not line up in their thought processes or may not line up in their belief systems and value systems with our own. And that's really important. One of the things that we need to consider is our own sense of self-awareness. And one of the things that we've come to understand is a lot of research within the social sciences tells us that oftentimes our own values and beliefs are sometimes inconsistent with our behaviors, and it may be unwittingly, unknowingly, that there is that dichotomy, that split. The research tells us that sometimes our values and beliefs may be inconsistent with our own behaviors, and we may not be simply aware or have knowledge of it. That all of us sitting in this room together, all of us watching this presentation, have to recognize the fact that because we are human beings, that oftentimes our brains, our thought process make assumptions without us even knowing it. We just naturally assume based on our own life experiences, and we make those assumptions without our full awareness, and that has an impact. And it's really important to do. It's really important for us to understand that as human beings, we make those assumptions almost knee-jerk, almost without thinking about them. So when we talk about unconscious bias, look at some of the examples. It says, I have no problem with gay people as long as they don't wear it on their sleeve. Think about how many times you have been in conversations with people and maybe you have heard this exact statement, or maybe one that was very similar. She's real pretty. I couldn't tell that she was transgendered. Again, a bias, right? A preconceived notion or an idea that may not be based on fact or reality. Again, the other statement, how do you know you're gay if you've never been with a person of the opposite sex? Again, showing our bias. And we're going to talk a little bit about privilege, but we'll do that soon. So one of the things I'll share with you is that, the challenges for us as clinicians is to be open to other people's individuality. That just because you may have worked with one fill in the blank, lesbian, bisexual, transgendered individual, doesn't mean that the next person will be just like them. That every person that steps in our office has their own sense of context of their lives. And that's the challenge for us as clinicians, is to be able to discover and learn about the context of the individual that's sitting in front of us. And what I would share with you is within the LGBTQ community, there is a vast difference in the context of their lives than in the lives of heterosexual folks. So one of the things we have to do is be sure not to label our clients. And I'll be honest with you, this is true just in the general states of what it means to be a practice. Don't label your clients. Our challenge is to meet clients exactly where they are, to respect their process as they are coming out, as they are living into their sense of who they are in all those various areas, emotionally, intellectually, spiritually, physically, all those areas. Because it's going to be very important that as they sit in front of us, that they have a need to feel safe and that this is a safe place for them to explore all those various areas of their lives in which they're trying to figure out. When we talk about the concept that it gets floated around sometimes about cultural competency and cultural humility, the expert of that particular individual may be sitting in your office. So one of the challenges is, can we sit back and be guided by our client, by that LGBTQ client, listen to what they say, and being able to listen so that they can feel comfortable, to reflect back to them through our gestures and through our body language and through our affirmations, that we are listening actively so that they can feel comfortable. One of the things that is experienced within the LGBTQ community are what we call interpersonal stigmas and phobias. Particular to this population is family rejection. One of the most common things that happens within LGBTQ individuals as they come out to their families for various reasons, oftentimes religious, oftentimes cultural, families reject them. We all know that we've heard the stories about, a man or a woman comes out as gay or lesbian or bisexual, transgendered, and the family literally cuts off all ties, kicks them out of the house. They experience peer harassment, bullying. We're going to look at some stats in just a little bit to see how that begins and how that begins so oftentimes at a very early age. And even when they go to work, when they try to do the jobs that they were trained to do, they experience harassment oftentimes from the very coworkers that they're working side by side. They experience rejection from potential romantic and sexual interests as they begin to learn what it means to be a sexual person, what it means to be romantic. They find rejection of their own sense of identity within their own population, of how they define themselves as a gay person or how they define themselves as a lesbian person. So there's a lot of interpersonal stigma that they have to deal with and phobias that they have to deal with. Then there's intrapersonal, and that's the shame and trauma. So think about family rejection, think about bullying, thinking about harassment, think about being cut off from family, the shame that they experience, then that shame becomes internalized, trauma, their own internalized homophobia and transphobia. All these things kind of come into play with what this particular demographic has to deal with. So important to kind of keep that in mind. So one of the things I want to share with you is one of the things that we're facing today in the here and now, in the present, is sometimes a reversal of non-discriminatory laws that we find from state to state. This particular statistic was taken from 2014. The purple states, the states banning discrimination based on sexual orientation and gender identity, 18 states in the District of Columbia. Orange, laws banning discrimination based on sexual orientation, 3 states. So you can see that there is this disparity that automatically breeds discrimination within many communities across our country. So one of the things is, how do we go about providing a safe place for our clients? Let's take a look. So where do we start? So one of the things I'd like to share with you is, let's take a look for just a little bit of who's waiting in your office to come see you. Some of the common issues that are facing LGBTQ community is depression, anxiety, whether it's familial or social oppression, substance use disorders, adjustment disorders. They experience societal anxiety, thinking about, what you and I might think of is absolutely normal is not for them. Think about a heterosexual couple who's walking down the street hand in hand, holding hands together, and how for some people within the LGBTQ community, that is anxiety producing based on their fear of how people might respond. Any kind of show of public affection, here again, raises the anxiety within that demographic, within these group of folks. Domestic violence and intimate partner violence. Here again, this is so very different. Many of the same-sex couples' domestic violence rates are high as mixed-sex couple rates. I wonder how many of us knew that domestic violence, intimate partner violence within same-sex couple is the rates are just as high. Intimate partner violence among LGBTQ oftentimes goes unreported. When the police are called, they don't treat the situation as intimate partner violence. They usually discount, brush off, and don't take seriously what's going on. Suicide within this demographic, within this community. What we know is that the stats are showing us that with every episode of victimization, whether it's verbal, physical, increases 2.5 times more likely of self-harm behaviors within the LGBTQ community, within that demographic. So every time they experience that kind of victimization, it increases the likelihood of their own self-harm. We've also found that the risk of suicide is also further directly linked to also the psychological stressors, going to work, harassment, victimization, having a negative work experience, and housing discrimination. So one of the things we know is that 85% of LGBTQ adolescents and youth have been verbally harassed at school. 85%. That's a huge number. 50%, 56% have heard homo or transphobic remarks by teachers and school staff. Now think about other people. So think about that for a minute. Teachers are supposed to be the professionals and the authority figures. School staff are supposed to be the authority figures with whom provide a safe learning environment for every student that walks in the door, to take seriously the needs and concerns of every student that they work with every student that they teach. And yet half of all LGBTQ adolescents and youth hear homophobic or transphobic remarks by the very teachers and school staff that are there to provide a non-judgmental, safe environment for them to learn in. So think about how that affects their ability to learn. Think about how that affects their willingness to interact in a school setting. 37% of LGBTQ skip school because they don't feel safe. 37%. 47% have been physically harassed at school, pushed, shoved. 23% have been assaulted at school. And here again, what the stats are telling us is when those harassments take place, when those assaults take place, oftentimes they're brushed off, not taken seriously by people who have the responsibility of providing a safe environment for all students. So I want to turn next, if that's an idea, I want to take a look at the current clinical environment. So one of the things that we know is that there's a disparity. We know that people who self-identify as LGBTQ, when they go looking for a mental health professional, experience and are confronted with a lack of knowledge and understanding of the needs of LGBTQ people by mental health professionals. This is based on research done in 2020. So think about that for a minute. They're walking in the door, and one of the things that they experience is a lack of knowledge and understanding of who they are as people. One of the things that they experience too is a stigma, dual barriers. One, to the stigma of having mental health problems, and also identifying as a minority population. They feel ignored and mistreated because of their sexual orientation or gender, and oftentimes they are silenced out of their own fear. One of the things that we found in the statistics is that oftentimes the LGBTQ individual who goes into the mental health field or goes looking for a mental health professional feels like that they spend more time educating the provider and the therapist than actually getting the help that they need. A lack of understanding. Studies show that individuals being exposed to providers with limited knowledge of understanding of specific needs of LGBTQ clients. They oftentimes feel pathologized. They feel undertreated by the primary mental health professionals when they come looking for helping them to address their primary mental health issues. A lack of knowledge leaves these individuals, leaves people who are part of the LGBTQ community feeling vulnerable and hopeless. If there is anything that we do as clinicians in the mental health field, is to provide an environment where individuals can feel safe and also have hope. In addition, LGBTQ individuals feel that they are marginalized, often at a risk of discrimination due to their sexual, gender, and affectional minority orientations. While queer people experience heightened prejudice, research from the American Psychiatric Association has indicated a lack of suitable counseling for LGBT groups that would greatly benefit from increased services. Wow. A survey of the Center for American Process shows that a lack of trust exists between the LGBT community for healthcare systems. So they are already walking in the door with a feeling of mistrust, fear, anxiety, and whether or not they can be vulnerable. So let's take a look at the providers. 82% of nursing and medical students stated that they lacked the necessary knowledge for the delivery of culturally competent care. 82%. Medical schools report a median of 5 hours dedicated to LGBTQ related content among the 167 medical schools across the United States. In a reviewing of nursing and medical schools literature, only 0.16% of the literature discussed mental health, LGBTQ mental health. So here we are dealing with a population that is fearful of being vulnerable and open with mental health professionals who report that they experience mental health professionals as undereducated, not fully up on the various aspects of working with this population. 82% of nurses and medical students feel like they're not ready to serve this population. So here's an interesting statistic. So look at that first one. 854 agencies, when asked, said that they indicated that they provided LGBTQ specific services at the time of the phone contact. Only 249 actually had specialized program, 29%. 79 of the 854 described themselves as non-discriminating. 34 out of the 854 programs described themselves as accepting, some responding, "We don't have special services for gays and lesbians, we just allow them in our group." Well, that's the law. What are we doing, and what programs and what services are we providing that meet the very specific needs of this population? If we're dealing with mental health and medical professionals who don't have a full girth of understanding of this particular demographic, it's no wonder that when these individuals, these people who are desperately seeking our help, find it difficult. One of the things that I'll share with you that's not in the stats, but I wanted to share with you. So I work in the field of addiction. I do a lot of work with people who are struggling with alcohol use disorders, substance use disorders, problematic sexual behavior disorders. And one of the stats that I found was that people within the LGBTQ community who enter into residential treatment, the stats tell us that over half of them will leave treatment early because they feel unheard and unsafe. This is what's going on within this LGBTQ community. This is what they are struggling with. All right, the coming out process. Very important, vulnerable time for people within the LGBTQ community. Coming out is a process. It's when the individual begins to accept, when they begin to identify their gender identity and their sexual orientation. And as they begin to share this identity willingly with others. That's that process. Coming out is rarely a one-time thing. More commonly, it's a series of decisions, sometimes on a day-to-day basis, as people, the LGBT people in the community, navigate every new environment and setting and situation that they enter. People may be out in some spaces and in others. They may be out to family, but in to friends. They may be out to classmates and coworkers, but in with the religious community. So it's this process, and it's different with every situation. One of the things that we know is that it's dangerous and unhealthy and not helpful to force or to intimidate someone to come out with their gender identity or sexual orientation to others without, that consent, regardless of our intentions. We don't out people as mental health professionals, regardless of what our intentions are. Some things that we can do, know this is a sign of trust. That's huge. Check in on how confidential this is. Do other people know? Is this a secret? Remember that gender and sexuality is just one dimension of many of who people are. It's important for us to listen with curiosity, to listen with interest about this part of their lives as they're sharing it with us. And to be able to simply ask, let the patient teach us, how best can we support them in this process? Some don'ts. I always knew, don't downplay the significance of them sharing that information with you. We don't tell everyone bragging about your new trans friend. Forget that they are still a person that you knew, that you befriended, and you're loved. Assume that you know why they came out to you. You can't assume anything. So how do we go about changing the system? So one of the things is that we utilize an LGBTQ patient advocate. So this may be in a treatment facility. It may be someone who has some specialized training to understand and to be an advocate for LGBTQ individuals as they come into treatment or as they come into private practice. That advocate has specialized training. They meet one-on-one. That individual does not have to be someone who self-identifies as LGBTQ. Think about your own practice, or think about where you work in the mental health field. Are you communicating a culturally safe environment through your signage? Are you utilizing the recognized cultural icons of this community, of this demographic? If you go to my website, you'll see that I use these various forms of signage, and it makes a difference. I've had several clients who told me that immediately when they saw this, they felt that this might be a safe environment. Identify resources and contacts for questions and concerns. Think about people who might be able to help further educate you within this demographic. Part of what this presentation is about. Think about taking cultural humility training. There are lots of programs and classes for staffs. There are classes for patients and clients. Cultural humility is when we understand that we can learn from the client, recognize our own biases, being culturally sensitive to the people that we work with. And then finally, think about the forms that you use on a day-to-day basis, the procedures that you use when you're working with a new client. Forms, documentation, inclusive gender, sexual identities, inclusive terminology for married and non-married couples and spouses, non-assumptions and biopsychosocial assessments and paperwork, to be able to identify pronoun gender preference. All of these things help provide a safe place and a welcoming environment to this demographic. Changing the system. Specialized programming. Elective programming specializing in LGBTQ. Facilities, resources, if gender specific, are utilized based on self-identified gender. Mentoring, pairing a client or a patient with a program participant or an alumnus or someone that they share similar identities if they're going into treatment. Sometimes this is done in person, sometimes by phone. So, looking at our time, I have some scenarios here. Let's take one. I'm happy with them. Okay. So here's a scenario. You're interacting with someone new, and they introduce themselves as Alex, and they look very androgynous. You're not really sure what pronouns to use. What should you do? Take a minute, respond. How would you respond to that scenario? Introduce themselves as Alex. They're looking very androgynous. You're not sure what pronoun to use. What do you do? Okay, yeah, I might refer to them just by their name, and then look for ways that they put on what they put on the form. Yeah, absolutely. Okay, all right. Introduce yourself, client. Yeah, ask the client, ask the individual what they prefer. It's okay not to know. If you're uncertain, if you're unclear, it's perfectly okay to be able to ask a client or an individual, what preferred pronouns would you like me to use? That's a great way to do it. Lots of good responses. That's great. You're giving a tour to someone who you are considering hiring, and they ask as if the office is LGBTQ friendly. How might you respond to that? You're giving someone a tour that you're considering hiring, and they asked if the office is LGBTQ friendly. What would you mind? Anybody, what might you say? Mhm. You know, this is where it's okay to be able to say, one, yes, we are. It's also another way in which we can also say, this is becoming a priority for us. We're working on it. We're looking for ways to be more inviting and friendly to this community. So take a look at this. A student or a participant you work with on a regular basis shares with you that they are gay, and they are nervous to tell others and worried about how this will affect their hireability in the future. How do you support that person? They're concerned about coming out. They're talking about sharing, telling others about their sexual or affectional orientation because they're worried about how that will affect their hireability. What might you say? I think that's great. Listen, ask for more detail, listen with curiosity, ask questions, and be encouraging. Absolutely. Yeah. Don't deny the reality or the possibility. I wish I could say that you're going into an environment to where you'll never have to worry about, but the reality is that there are places out there, and there will be times when that will affect a higher ability. I love that idea, right? Help the client find a mentor who can help them navigate the system. What a great way. Help them find someone who has walked that path, a companion, someone who can help them navigate. Yeah, great response. A staff member shares at a staff meeting that they are trans and would like everyone to use a new name and the pronouns they, them, theirs. While everyone at the staff meeting is very positive and affirming in the moment, afterwards, there's a lot of confusion and hesitancy about how to proceed. People aren't sure how to let others know what to do when they mess up pronouns and names, what other types of support this person may want or need. How might you respond? Somebody comes into your meeting, they announce they're trans, they share with you the new name and the pronouns that they would like to be used. Everybody responds very positively, but afterwards there's some confusion and concern about, how do we tell other people? How do we, what do we do when we make mistakes? How might you respond? Here again, I think, when we mess up, we mess up. It only shows our humanity. We apologize and we get the new information. Yeah, absolutely. You bring up the idea of your team during a diversity inclusion training. There are lots of eye rolling and no one says anything affirming about the idea. Someone comments, we're all really accepting here. I don't think we need that sort of training. How might you respond? Yeah, everyone can improve. That's the thing about cultural humility, is understanding that our sensitivity, our awareness, our knowledge, our understanding can always be improved. We never arrive. We're never at a place to where we've got all the answers. We know exactly what to do. There's always room, always a place for improvement. So one of the things I would share with you in conclusions is that LGBTQ clients and patients can experience significant challenges related to their gender and sexual orientation, affectional orientation. We have to acknowledge the full identity of the person who's receiving our services. We have to have the capacity to challenge our biases so that we can prepare us to deliver better, more person-centered services. Developing a sense of cultural humility, that kind of being openness, is a lifelong learning process. Individuals that don't need to act, to wait for their organizations to act. We can do that on our own. So, questions. Anna, I'm going to kind of bring you back in, and happy to help with any questions that people might have.
Awesome. Thank you so much for that presentation. And as people are listening to the Q&A too, please do go ahead and continue dropping those questions in the chat. or in the Q&A box even is better. So let's see, I have a few here. Okay, one of the questions is, what type of specialized training would you recommend for a patient advocate or even just my therapist? And I would add to that, do you have any like specific organizations that you have enjoyed their training or recommendations of where to look?
Yes, there are. So SAGE is one of them. They offer a lot of advocacy training. You can Google, you know, affectional orientation training, and there's lots of things to do. And what I will do is, that's something I meant to do. I will send Anna some of the resources for people who are looking for that kind of advocacy training, because there's a lot of it out there. Some of it's free. Some of it's very inexpensive. There are certifications that are available for people who want to be certified as an LGBTQ advocate. So yeah, there's lots of opportunities out there, and I'll be sure and send those.
Yeah, and I would be happy to share those. So if you want to, if you're watching this and are interested and want to email Steve, you can do that. Otherwise, you can look for a follow-up email from
Yeah, absolutely. My email's there if you want to contact me directly. I'm happy to hear from folks.
Yeah, and I think, I guess going off that question, one of the things I've heard recently in the industry is people coming in, or I was chatting with people, and they're saying like, I want to create this specialized program, right? The rehab that they work at wants to do a specialized program, but they don't really know how to start. So I guess my question would be, when do you think someone can put on the safe space for LGBTQ on their practice and really mean it, rather than just being kind of like well-intended? What would you say is an ethical time or a place to put that up?
Well, I think there's several things. So one is to have a very clear understanding of the various needs and concerns of the LGBTQ community. And here again, there are books and books and books, and I'm happy there's a couple of them that I use that help educate people. And there are also lots of literature. And I'll send the title of the book that deals specifically is, how do you go about preparing yourself so that you can see yourself of having the competencies in those areas. And they talk about the various ways, like for instance, intersectionality. That means the various social, religious, familial contexts that LGBTQ people have to deal with. I may have a client who might be Puerto Rican and Roman Catholic and gay, and there are lots of intersections about the various dynamics that go on for him to be and to affirm his own affectional orientation. So yes, I think there are lots of things that people can do. I think to be informed, to be educated, to be able to know their biases, to have their own awareness of their own sense of privilege, to be able to understand that when they have somebody sitting in front of them, that here is a unique individual with their own special needs, and knowing what those needs are as that person sits across from you. And that's just done by psychoeducation, training, all those kinds of things.
Yeah, I think that's super important. Even just looking at the statistics and kind of just like we would, we would have for other populations that we specialize in, or even disorders that you specialize in, knowing some of the statistics and tendencies and common struggles can at least, obviously not everyone is going to fit those statistics, but knowing the commonalities and some things that occur frequently, so that you can ask the right questions or push in the right direction, or just be aware of, things that people may be kind of like just lying under the surface, knowing those possibilities, right?
Right.
Yeah.
Understanding the unique needs.
Yeah, totally. Great. Okay. So I have this question one time in the Q&A, and then I saw again, someone DM'd, how did you become passionate about this subject? I think people are interested, given that you were a minister for 20 years And, and I think in the media and in a lot of people that we personally know, those two subjects don't often intertwine well.
Yeah. Well, so growing up within the United Methodist Church, so I'm a New Orleans boy, born and raised and grew up in New Orleans, an incredibly culturally diverse city. At the time, decades ago, when I was growing up, New Orleans was, I think, either the second or probably the third largest port in the nation. And so it was a melting pot. And I'm not exactly sure, but I grew up around this kind of incredibly diverse culture, of which the LGBTQ community was very much alive and active. And so, and then when I went into seminary and was ordained and starting in pastoral ministry, I began to see the prejudice and the disparity that within the church. And so that my definition and understanding of spirituality is about including rather than excluding people. And so I saw this, and as many of you know, this is one of the major issues within this particular denomination that's causing it to split or has split at this very moment. But I saw communities and cultures passing and being judgmental based on one sliver of an individual's life. And so it became very important to me that here was a place in which I could educate myself so that these people could feel like that they were heard and had a place. That's been one of the driving forces for me, because I've talked about this in other settings, and I do trainings all the time with treatment centers and things like that. And this is the population that is underserved. It's like, I can't say it enough. The LGBTQ folks walk into our offices and they are already afraid because they are fearful of being unheard and not respected. So it's very important for me.
Yeah, I think that's really neat. And the point about and we had another speaker series almost a year ago, I think, where we had a person who came out as trans just a few months later, talking about what it feels like to walk into a doctor's office and have to teach them about you rather than it. And so creating a space where you walk in, you feel safe and understood from the jump, I think is really important.
And I think it's important because think about people who don't have that concern. And here we are back at privilege, right? How many people, heterosexual, white males, walk into a therapy or seeking mental health professionals and do so? They walk in because they know that they don't have that fear of being unheard. They don't have that fear of being unsafe. Yeah, absolutely.
Well, thank you for sharing that. I think it's really, I think there's a place for, obviously a lot of the education that we see is rightfully from people from the LGBTQ community, but there's a place for everybody. And there are people who are coming from all different backgrounds who need to be able to learn how to, I love the, what was it? Cultural humility. Yeah. I think that approach is so beautiful, rather than just being confident in their culture, understanding that Absolutely. You have something to learn from them. And so I appreciate your work here too. Okay, I have two more and then we'll wrap unless I see anything else come in. This person says, I have some old school colleagues who don't believe they have unconscious bias, but it seems so clear to me that everyone has it. Is there anything I can do to help them see past their own nose and better care for their clients? That's hard. it's one thing to look inside yourself, and it's another thing, and it's painful sometimes to see people around you who are hurting people by not seeing their own bias, but not know what to do, especially not wanting to overstep and be codependent, right?
So here's what I'll share with you. I feel the despair and I feel the concern about your friends being unable to acknowledge that they have unconscious bias. I wish I could tell you that there are 3 bullet points and you can bring that to their awareness. Unfortunately, the best that we can do is to be faithful and to model, to be able to identify our unconscious bias. Here's my experience. There will come a moment and there will come a time when that realization, that awareness of their unconscious bias will come about. It will not be pleasant and it will be difficult. It will be painful, but unfortunately, that's the process. To say that you don't have an unconscious bias is a form of denial. And, life has a way of presenting us and putting us in situations and environments to where we're challenged. So the best that we can do is to be ourselves, to model, and to have compassion.
Yeah. That's a hard one. It's something,
Absolutely.
I feel this really, it resonates when I was reading it. It's so easy to want to kind of swoop in, and it almost it can feel like standing up to a bully a little bit, right?
Absolutely.
So there feels like there's some justice in it, but gosh,
yeah,
it's hard. Yeah.
Sure.
That's a tough one. Okay, so next one, and we'll wrap with this. Do you think after family has rejected one of their family members, I'm assuming for being LGBTQ, is there a possibility to break through that and heal? And I know I'll add to that. I think you talked a lot about creating a safe and understanding place for clients from a clinician perspective. Is there a way that as clinicians, we can help, or my colleagues, I guess, can help create a safe and understanding place in a family that has some brokenness there?
So what I would share with you is the way that I would address that is that, what are the commonalities? Where can we agree? Where can we come together? If not affectional or sexual orientation, where else can we come to? That's been my experience with families who have felt disconnected, cut off, that the therapist can provide an excellent conduit of providing the common space of ways in which to kind of rebuild that relationship. That the the affectional orientation, sexual orientation is a part of who they are. It's a big part, but not all of who they are. So where's the common ground for all of us in our relationships to each other? That a therapist can be an incredible tool for that kind of objective third person.
Yeah, thank you for sharing that. There's so much hurt that can happen in families, but watching a family heal together, and sometimes it just takes one person to start that loop. But at AP, we're so passionate about family therapy because the ability for a client to succeed after, like, when they head out into recovery, whether it's from mental health or addiction, is so much greater when their family is a healthy place to come back to. And
absolutely,
so
100%.
Yeah. Well, Steve, thank you so much for being here today. Like I said, I really appreciate your perspective, and just and the cultural humility, honestly, that you show by and that you're modeling right now by having a place of privilege in many ways, but advocating for people who are underserved.
Yeah.
That's a huge thing to do, and important as we're in these helping professions. And so I appreciate you being here. Again, please feel free to reach out to Steve if you're watching. Also, feel free to reach out to us. And stay tuned soon for the announcement of our next speaker series. And we really appreciate you joining today. We will see you soon. Thank you, everyone. Have a great day.
Thank you all.